We begin tonight with money, what it's going to take to keep Canadian families and businesses afloat through the months ahead. The federal finance minister, Chrystia Freeland, who took over the job in August, has laid out how much will be spent to shore up the economy until this pandemic is over. Before COVID-19, Canada's deficit for 2020 was projected to be about $34 billion. By July, the government predicted it would balloon 10 times that to $343 billion. Well, now Freeland says it's likely to jump to $381 billion because $25 billion is being spent on new programs the finance minister says will set the stage for Canada's recovery. The wage subsidy is being increased. Parents of young children will get more through the Canada Child Benefit. There's help for airlines and tourism and money going to the provinces to spend on improving long-term care. The finance minister says the risks of providing too much support outweigh the risks of not spending enough. David Akin breaks it down in our top story tonight.
Canadians should know that their federal government will be there to help them get through it, come what may.
And to do that, Ottawa will rack up monster deficits. Most of that red ink is a result of COVID-19 related support programs already in place.
We will do whatever it takes to help Canadians stay healthy, safe, and solvent. We will invest in every necessary public health measure, and we will support Canadian families and Canadian businesses in a deliberate, prudent, and effective way.
But Chrystia Freeland will add to it with some new items. For example, there will be a temporary boost to the Canada Child Benefit of up to $1,200 per child under the age of 6. This will be a means-tested benefit and available only for low and middle-income families. Ottawa will set up a new lending program for tourist businesses, airlines, hotels, and other firms hard hit by the pandemic. Loans of up to $1 million on a 10-year term at ultra-low rates will be available, all 100% backed by the government. The provinces will split an extra $1 billion, which they can use to improve long-term care facilities. And those crucial business support programs like the emergency rent subsidy and the emergency wage subsidy, well, they've been locked in until June. On top of that, the government has boosted the wage subsidy to 75% from 60%, and that rate has been locked in at least until the middle of March. Freeland's fiscal statement also lays some markers for future spending on pharmacare and childcare, but does not commit to major spending now on either of those files. But Freeland does say that starting next year, the government will put aside between $70 to $100 billion a year for 3 years in a row on economic recovery projects. Details of that spending will be announced later and would conceivably add to future deficits.
And so now, Donna, the political debate begins, and it really hinges on this question. Can we afford all this spending? Can we afford all these deficits? And quite clearly the government says yes, and you can expect that Chrystia Freeland and her cabinet colleagues will now move about the country with this message that Canada can't afford not to spend this money to get us to the other side of the pandemic. Donna?
Okay, David Akin in Ottawa, thanks. Mercedes Stephenson is with me now from Ottawa. Mercedes, not too many people envy Chrystia Freeland right now. Managing the country's finances in a pandemic requires going into uncharted territory. What stood out to you in this fiscal update?
Well, Donna, what stood out to me is that it looked more like a budget than a fiscal update. It was over 270 pages and very detailed on the now. It was really that focus on managing from day to day, and that is what a lot of Canadians wanted to hear. They're relying on programs they've already established that they believe they have evidence are working well to serve businesses and Canadians. They're going to refine those programs, but this is not the time for them to float the big ideas or put a lot of money into programs that they are unsure of. So you're certainly seeing them focusing in on that day-to-day, really how to get Canadians through the pandemic and then worry about what's on the other side later. It's a tough thing for the Conservatives to attack, and it gives them lots of room to negotiate with the NDP to stay in power.
Well, the Liberals got elected on promises of national child care, a national child care program, a national pharmacare program. Are those ideas on ice now?
Well, they're still in this document, but there's basically no details and no money really allocated to them. And these are two very expensive programs. Not because they're not looking at them, Donna, but because I believe they are saving their political firepower for the spring. This is what you can expect to see in the spring budget. And if the opposition then tries to bring the government down over these issues, I've certainly talked to a lot of senior Liberals who are more than willing to fight an election on them.
All right, election talk again. We're Stephenson in Ottawa. Thanks.
Never ends.